Good morning and welcome to Today in Putnam County, hosted by Putnam County Mayor Randy Porter, the show that takes a look at the events and what's happening all around Putnam County, as well as interviews with local, community, and business leaders. And now, sharing his insights and experience, here's Today in Putnam County with County Mayor Randy Porter.
Good day, and thanks for joining us this week for Today in Putnam County. I'm County Mayor Randy Porter. Hope you're having a great weekend. Our show this week, it's about Breast Cancer Awareness Month and one of our local nonprofits, the CRMC Charitable Foundation, and how they help with breast cancer detection and much more in our community. You know, when you start thinking about breast cancer, folks think it's only a female problem, but it's not. There are thousands of men that have breast cancer each year. So we're going to try to give you a lot of information today that you might not know, ways that you can get help and awareness, and the ways that our charitable foundation are helping our community. My guests this week are John Bell. He's his executive director for the CRMC Foundation, and Amanda Bain. She's the director of imaging at CRMC's Women's Center. Thanks for joining us today, guys. Appreciate y'all being on the show.
Thank you for having me.
So, Amanda, October's Breast Cancer Awareness Month.
It is.
Trying to make everybody aware. We get in our busy lives every day, and sometimes we don't do our colonoscopies, we don't do our breast exams, we don't do all the things we need to be doing, blood work and stuff, to make sure that we're healthy. This is trying to bring awareness to that and to get women to go and be checked out, right?
Yes, most definitely. It's very important. I know a lot of us live off of our calendars, and even if it takes setting an annual calendar reminder to get your mammogram every year or a monthly reminder to do your breast self-check exams, it can make a huge difference in early detection.
Difference in life and death,
most
when
definitely.
It comes down to it. I was looking at some stats. It says in 2024, in this year, there'll be 360,000 people diagnosed with breast cancer.
Yes.
That's a lot of people, but coming off of the cancer website, it said 99% survival rate if it's early detected.
Yes, and we have so much technology available. There's so many opportunities to prevent it getting that far. I just encourage everyone to utilize that and to take it seriously.
So my wife had breast cancer 2 years ago, actually just about this time 2 years ago, and you go from everything's okay one day to the next day and everything is not okay. It's amazing. I'll never forget that day that she called me to tell me that the test came back. Thankfully, hers was caused by a hormone replacement after she'd had a hysterectomy.
Yes.
And so that's what was feeding the tumor. So once she went through the surgery and some radiation, totally clear now and everything's good.
That's awesome.
What I was amazed at is all the technology and the way that the hospital has it all figured out and got it all going. You know, you don't know what to do.
Right.
So you go and you have that she had that mammogram. She found out that she had this place and then had to schedule the biopsy and then this blah, 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 blah. But she had a person at the hospital that helped her and walked her through everything that was going to happen. And let me tell you, folks in the imaging center, the folks at the cancer center, they are unbelievable. Some of the nicest people. And so
yes, they are. Thank you.
You just have to just got to let them help you, and that's the way it goes.
Yes, we've worked very hard to try to put a team together from registration at the front desk to our wonderfully skilled technologists. We are blessed to have an imaging navigator that a lot of places do not have, and she is able to help navigate that from the imaging perspective, even from the time of, a worrisome screening mammogram to help you get set up for a diagnostic and then a biopsy. And then if we need to, when we have even recently been able to implement where we go ahead and set up an appointment to give those results after the biopsy. And if those results are positive, we deliver those results in coordination with Amy Ayers, the Cancer Center navigator. And at that time, we hand off care to her, and then she helps navigate it forward through surgery, treatment, and survival.
Well, when we talk about early detection, John, the CRMC Foundation, I was looking at some of your stats, and of course, one of the big events here in Cookeville every year is the Pink Gala. Sure. And the Hospital Foundation is trying to help women that maybe can't afford those mammograms to get them a free mammogram. And I was looking at some of your stats of the folks that you've helped this past calendar year, 528 cancer patients, about 2,530 people altogether. So
That's right.
Tell us about the foundation and how that y'all are working to help in that early detection of cancer.
Yeah, specifically for early detection, for those screening programs, we don't want that to be a barrier. And so it works in tandem with really the regular intake process at the Women's Center. So if you're worried about not being able to afford a mammogram, don't let it worry you. Come and see. And if your insurance won't cover it, we will cover it for you through the Pink Ribbon program. That's why we have the Pink Gala, so that we can say to all women living in the Upper Cumberland, we're here to help. Don't let that fear of cost be the one barrier keeping you from getting that mammogram. Come to the Women's Center, call them, schedule that appointment. And if your insurance won't cover it, we will.
Well, and that's a great thing for our community, because there are folks out there that either don't have insurance, it's not offered at their job, or
Sure.
they can't afford it, and single moms, all kinds of different things going on out there that this allows them that they're going to get their mammogram.
Right.
I mean, that's such the thing of it is having that done every year, isn't it? Because I mean,
Yes.
with my wife, the previous year was clear.
Yes.
And then she goes in for a regular year, and all of a sudden it's there. And I hear stories from folks that I skipped a year, I skipped 2 years, and then all of a sudden it's progressed, and it's hard to treat then.
Yes. Well, there are so many conflicting recommendations out there, too, that I think can sometimes come into play there, but a lot can happen in a year. I think it's very important to stick with that. And American College of Radiology does recommend annual screenings. You know, it's just important to stay on top of it, because truly the sooner you can get on a treatment plan, if something's detected, the better
So-
the outcome.
What about the age now that they're recommended for women to start having mammograms? Is it changed?
It's age 40.
40.
And we are still, there's a lot more out there as far as if patients are high risk. And we're starting to see some younger patients developing, lumps and worrisome, or they're getting their genetic testing and they're determining high risk. And so we may start with ultrasound a little bit sooner.
So you want ladies and even young girls to start early doing the self-checks, because you don't have to be 40 to get breast cancer, do you?
Right. No, the sooner the better. I think it's important that you know your body, and that way you are able to determine if something's different and to act on that if you do find something.
John, with the Hospital Foundation, of course, you do the Pink Gala and that you get donations, but folks can donate to you year-round, right?
Absolutely, yeah. We're a 501c3 nonprofit, of course, affiliated with the hospital, but the Pink Ribbon program itself is restricted just for those screening programs. And we don't take anything out for overhead staff expense, so it all goes to provide those mammograms to women or men who could not access it on their own and have a need for it.
And so if someone wants to donate that's listening, how do they go about that, John?
Yes, the easiest way is to do it online at cookvilleregionalcharity.org, and you click the Donate Now button in the top right, and then you can select the Pink Ribbon program, and 100% of your gift will be used and restricted for that purpose.
Folks, this is important. It's Breast Cancer Awareness Month. That's what our show is about today, and the CRMC Foundation that helps men and women that can't afford to get their mammograms or other tests that we're going to talk about with John going forward. We got to take a break. Stay with us. More with John Bell and Amanda Bain after this.
And now back to Today in Putnam County, hosted by Putnam County Mayor Randy Porter.
Welcome back to Today in Putnam County. I'm your host, County Mayor Randy Porter. Hope you're having a great weekend. Our show this week, it's about Breast Cancer Awareness Month. And it's something that everyone needs to be concerned about. It's not just a female thing, guys. There are men out there that get breast cancer every year, thousands of them. And so we have to be careful too, and do this self-detection and do the testing that needs to be done if you find something. My guest this week are John Bell. He's the executive director of the CRMC Foundation that helps with paying for mammograms and so forth. And Amanda Bain, she's the director of imaging at the hospital's Women's Center. And Amanda, we were talking about cancer and some of the risk factors. You've got the genetic factor that if mom had it, if grandmother had it, if sisters have had it, I mean, that gives you a higher risk for having it. So
Yes.
you need to be extra careful if there's people in your family that's had it, right?
Yes, I think that is why we, on our history forms, we always ask those questions. So it's important to know the family history, especially when it relates to previous types of cancer.
And to make sure that you do the self-examination, get your mammograms annually, make sure that you are really proactive when it comes to checking and making sure that you don't have the same thing.
Yes,
right?
definitely.
And then there's a lot of other stuff that are risk factors, things that we can do to help. Exercise,
Yes.
diet, control your weight, alcohol consumption. Hormone replacement therapy it's a big thing today, isn't it, with women, especially that have had hysterectomies and stuff. But that can
Yes.
be a feeder for a tumor, right?
It can.
So my wife, that's what she had with the tumor that she had. It was fed, and of course, turned out that was, if there had to be a good cancer that she had the best. It was easy treatable. But folks, we need to take in consideration the way we eat today and all the things, our busy lifestyles. We don't take care of ourselves.
We do not. And hormones play a big key in how we feel overall, but they are key contributors to our health as well.
So, Amanda, walk us through, if a lady finds or a gentleman finds a lump or something that's abnormal, walk through the process that you would go through to get this checked.
So once you find a problem, then that changes the treatment plan to start with a diagnostic mammogram. Usually that's what we start with, and in conjunction, it's used often if they feel like an ultrasound can be helpful. In conjunction with that, they will do that at the same time. We do try to give results from all of our diagnostic mammograms, that at the time of the service, just
that day,
just to try to ease.
So there's no waiting around. You got it in your mind and you're stressing over it. I'm sure y'all have had it too. Have tests done.
Yes.
It'd be a week, 10 days before you get the results. So it's same day.
Same day for our diagnostic mammograms. And so at that point, if we feel like it's worrisome, we may need to move forward with doing a biopsy just to see, what's that showing. Is it something to take more action on? We'll get that scheduled, and our imaging navigator, Christina Burgess, she works in the background feverishly trying to make sure that we have everything. We have the order, we have the insurance covered and all of that, and gets that scheduled. So once you come in for the biopsy, at that time we schedule your follow-up appointment to give those results, because we have to send that tissue to pathology and wait for those results to come back. And so once you come back for the results visit, if it's negative, you're great. They'll give you the recommendation of, follow up in 6 months, follow up in a year. Important to follow those guidelines just to make sure nothing else develops there. But if it is positive, that's where we would hand treatment over to Amy and the Cancer Center, and then they take wonderful care of our patients from there.
Depending on what the circumstances is. And not every lump is cancer, right?
No.
A lot are just something else besides cancer, right?
Yes. That's why it's important to get it checked, because if it is, it does need treatment, but if it's not, then that eases your anxiety and fears for sure, just to find out, just to know.
Yeah. John, how long ago did the Hospital Foundation decide that they needed to do something to try to help with the testing and the mammogram stuff?
Yeah, the foundation's been around for roughly 21 years now.
Wow.
I think the mammogram program itself is in its 15th year. So it's been here for a while, thankfully, and helped thousands of women access those mammograms and screening programs.
So we think Putnam County. That's the way we think, okay?
Sure.
The hospital is a regional hospital. I mean, you're serving, 14 counties probably, because you got areas like Clay County and Jackson County and Pickett County and Bain County. They don't even have a hospital.
That's right.
And so those folks are coming here. So it's just not about Putnam County. It's about the whole 14-county region.
It's not, yeah. We get referrals from all across the region, even into southern Kentucky. So they come from all over, but primarily the assistance that we're providing is for the 14 counties of the Upper Cumberland. So it's our friends and neighbors right here, at home.
Right, the ones we're taking care of. And yours is just not about the cancer screenings.
Sure.
I was looking at some of your numbers, and this would be, I guess, 2023 numbers. You helped 129 heart patients, 310 with medical equipment, 752 with other prevention screenings, community health patients, hospice patients. I mean, and then you do the Carmen CPR fund and all those. I mean, it's really, from where it started out at to where you are today, is absolutely amazing, John, as to the people that y'all are helping. Talk a little bit about some of these others.
Yeah, we've got a great team, and it's just an expansion of that our people taking care of our people philosophy that we have at CRMC. But these programs have expanded because of need and because we've had donors and volunteers and supporters step up and help us design them and grow them and implement them. We have restricted funds for many of the patient groups that are commonly struggling. So a cancer fund, a heart fund, a pediatric fund, a diabetes fund, etc. And there's many of those funds like them for specific patient groups. When folks donate to support, say, the Cancer Fund, that donation is 100% restricted. Same thing if you donate to the Pink Ribbon Fund, it's 100% restricted. And we can use that for any resident of the Upper Cumberland struggling with disease, sickness, or injury, whatever that variety may be. And then we have some kind of catch-all funds that are a little more flexible. Community health is one of them. That's for requests that come outside the CRMC system. So those requests may come on behalf of patients that are seeing someone at the health department, or maybe from a school system nurse. So it's from providers who are connected to us but not directly affiliated with CRMC. And then we have something called the Caring Hands Fund. That's the general fund for the hospital. So if a patient needs help at CRMC but doesn't meet one of these specific guidelines of the Cancer Fund or Heart Fund or whatever, we can utilize that fund to assist them as well.
Well, and you put on a lot of events too. And one thing I was looking at, you allow folks to donate used medical equipment, right? So
yes.
You get grandmother, grandfather that maybe breaks a hip or something, has a walker, has a wheelchair for a while. They recover, don't need it anymore. They can come and donate it?
Absolutely. Yeah. So if you've got something in your garage or tucked away in a closet, we would love to have it. If it's something we can clean, some type of durable piece of equipment like a wheelchair or a walker, or if it's something that's in its original packaging. So if you've got some tubing or whatever, as long as it's still packaged, we can take that kind of stuff too. And that's all provided for free to a patient when insurance won't cover it for them.
That's great. Phone number that folks can call if they want more information or want to donate?
Absolutely. 783-2003, or find us online at cookvilleregionalcharity.org.
Great organization. If you've want to donate funds or you want to donate used medical equipment to the Hospital Foundation. And we got to take a break. Talking with John Bell and Amanda Bain. This month is Breast Cancer Awareness Month, and folks, you got to take it serious. You got to do the self-exams. You got to go and get your mammograms, ladies. And guys, it happens to men, too. There's thousands of men each year that get diagnosed with breast cancer. We all got to be very diligent about taking care of ourselves. Stay with us. We'll be right back.
And now, back to Today in Putnam County, hosted by Putnam County Mayor Randy Porter.
Hope you're having a great weekend. Hey, fall is here, but it's also Breast Cancer Awareness Month, and that's what our show's about this week. I've got Amanda Bain. She's the Director of Imaging at the hospital's Women's Center. I also got John Bell. He's the Executive Director of the hospital's foundation. John's involved with the foundation of helping pay for mammograms and screenings for cancer and all kinds of other things. John, y'all do a bunch of events. You may put on more events a year than any other foundation I know, but it all goes to a great cause. Talk about some of these. I mean, like the Women's Heart that you put on each year.
Yeah, so we have 8 major events and then some many others that are a bit smaller. But the Women's Heart is typically in February, and all of these variety of events typically will fund one specific fund or program, and that's why we have so many. So Women's Heart is our only fundraising event specifically for our Heart Fund. So it's critical that each of these events is successful because it's benefiting a particular patient group that relies on those funds to continue to come in.
Right.
But the Heart event's a wonderful dinner event. It's a Thursday evening. It's about heart health education, particularly for women. It's not something we talk about very frequently. We more think of heart disease for men, but it's very, very common and is the leading cause of death for women in our country.
It's kind of like the cancer, isn't it? I mean, we think of breast cancer as being women only, and it's not. There's men gets it too. Pink Gala, my favorite, probably the premier event. I think of the community. Everyone loves it. Great time, great meal, but it's for such a worthy cause.
Yes, it's definitely a premier event, and we have a great team that puts in a tremendous amount of work for that one. It's in April, and if folks are interested, they'll want to buy those tickets early because we'll sell out
fast,
for sure. And then we have a couple golf tournaments in the summer. We have a 5K race for families to come out and run with us called the Summer Splash in June. We have a bike ride for kids. Coming up soon, our last event this year is Double Your Donation Day in November, second Tuesday in November. You can give to a particular fund or program at the foundation and have your gift matched dollar for dollar. So that one's a real important fundraising event for us. But all these events are critical because, it's about 35% of our income each year comes through these events. And the rest of it comes from grants and from individual donations. We need these events. We're glad people participate and encourage folks to donate on their own as well throughout the year.
Well, y'all are doing a great job with all that you do. And, some 2,530 patients that you helped last year. And I think you said it's up this year, right?
It is definitely up this year. We'll help at least 3,000 patients this year.
That is absolutely amazing, John. Y'all do a great job. All right, Amanda, we're going to play a game show today.
Okay.
This is our first game show on Today in Putnam County. We're going to see how knowledgeable you are. There's a lot of myths out there about breast cancer.
Yes.
And we thought we would try to knock some of those out today because we don't want folks thinking something that's not true.
Right.
So I'm going to give you a myth, and then you can tell me true or false. A breast injury can cause breast cancer. True or false?
False.
False. I mean, that's just a myth that's been out there that folks think that if they do damage, that it's automatically going to cause cancer.
Right.
But it doesn't, right?
No. An injury is an injury, but cancer is different.
Totally different. Breast cancer is more common in women with larger breasts. True or false?
False.
False. Doesn't make any difference, does it?
No, it's all breast tissue.
Yeah. Breast cancer only affects middle-aged or older women.
That's false. I mean, there's definitely younger women who experience breast cancer as well.
Here's one that I saw women do, and actually we had some at our church that did this, and carrying a cell phone in your bra can cause breast cancer.
False.
False.
I have seen a lot of chatter about that as well, but there's nothing
out there that substantiates that. Finding a lump in your breast means you have breast cancer.
That's false.
Well, you're doing good at this game. You're pretty good.
They can be lumps, but it can be just a fibrous glandular tissue. That's totally benign. So it's good to get it checked out, though, because if it is, it really does need to be treated. I
wonder what the percentage is of positives and negatives when it comes to mammograms. I mean, I'm sure y'all do thousands of those mammograms. I'm sure there's less than half that come back. Maybe
it's definitely less than half, but I don't have the exact statistics of that. Thankfully, a lot more negative than positive.
Men do not get breast cancer. It affects women only.
False.
Men get it. I was reading there's several thousand a year of men that get it. So, men, if you find something abnormal, doesn't feel right, and there's a lump there, you need to get it checked out because you could have it too.
Don't be embarrassed. It's very common, unfortunately, but we welcome you. Come and get checked out. Because
you can have the cancer and it be serious just the same as a female.
It can spread to other parts of the body. So, yes, please get it checked out.
True or false? A mammogram can cause breast cancer or spread it if you have it.
False.
Mammograms are good, right?
Mammograms are good. I mean, it does require radiation, but it's a risk versus benefit thought process. Like, you have to, ultrasound doesn't detect everything, MRI doesn't detect everything. Those modalities are used in conjunction with one another to provide a complete picture of what we're looking at.
Breast cancer is contagious. True or false?
False. It is not
contagious. Can't catch it from somebody else, can you? But that's a myth that's out there. There's a lot of folks think that, wait a minute, you've got cancer, I can't be around you.
Unfortunately, the genetics you can't get away from it, but that doesn't make it contagious.
That's right. Here's a big one. True or false? Antiperspirants and deodorants can cause breast cancer.
False.
There's a big market out there on this one, isn't it? There's a market trying to sell you all these all-natural deodorants and stuff, making you think that if you use those, it's going to keep you from getting breast cancer. That's not true, is it?
No, I know there's a lot of push behind all-natural everything these days. I would still, to each their own. If they want to use all-natural products, great, but I do not think I would shy away from using that as an alternative to getting my annual mammogram.
Right. True or false? Breastfeeding reduces the risk of breast cancer.
True.
There's a lot of folks that think that women that are breastfed that it can cause cancer, but that's not true, is it?
No, not true.
It's
Interesting.
Yeah, I mean, I've heard that one. I've heard folks say, I'm not going to breastfeed because that causes you at a later time in life that you're going to get breast cancer, but it's not. True or false? A healthy diet can help prevent breast cancer.
True.
We eat terribly anymore, don't we?
Yeah.
I mean, it's fast food.
Everything fast.
Yeah, I mean, it's just crazy, and we need to do a better job, but I'm as guilty as everybody. Smoking increases the chance of breast cancer. True.
Smoking increases the risk of a lot of things.
A lot of cancers and stuff, doesn't it? Good thing is, not as many people smoke anymore.
Thankfully, yes.
Thankfully, it used to be, when I was growing up, almost everyone smoked. Thankfully, it's changed. Is there a link between hormone replacement therapy and breast cancer?
Yes, unfortunately, there is. I think that's important to work closely with your physician to monitor hormone levels and just try to manage those the best you possibly can, because too much of any one thing can be detrimental, and a combination of those things sometimes, like your triple negative breast cancers, which is usually more so the lack thereof. But it's important to keep an eye on those levels.
So there was maybe it's still going on, but all these ads everywhere about hormone replacement, and these doctors were doing all these injections and hormone pellets and all these kind of things. You got to be careful with that, don't you? I mean, it can have major side effects.
Yes. I mean, it's definitely helpful for a lot of different things. I think it's just important to make sure those levels stay within normal range.
Right. Make sure you check with your doctor, have a local doctor that you trust in before you go and do some of those stuff. Guys, I appreciate y'all being on the show today. You've been very informative. Amanda, thank you for the job that you do at the Women's Center. I know that's a tough job, but you are helping thousands of people in our community every day, so I appreciate what you do.
Thank you.
John, Hospital Foundation, unbelievable. We support it. Everyone needs to. Before we go, give them the phone number again if they want to donate to the Hospital Foundation or want more information.
Yeah, find some ways to get involved. Donate, volunteer, do what you can. It's our people helping our people. So 931-783-2003 or CookevilleRegionalCharity.org.
Great. Everyone donate if you can. They do a great job. Got a couple of events we want to talk about. November the 2nd and the 3rd is the 5th Annual Cookeville Christmas Market. It's going to be from 10 a.m. to 4 p.m. at the Putnam County Fairgrounds. You get more information on my Facebook page. And then November the 30th, we got a new event that we're going to do. It's called Christmas on the Square. It's going to be from 2 to 5 on November the 30th. That's the Saturday after Thanksgiving. We're going to have train rides and games and bounce houses and free photos with Santa. It's shop local weekend, asking you to shop local with our merchants. And then the finale of that day is going to be the lighting of all the Christmas lights in the tree on the courthouse square. So we'll have more information about that coming up. We hope you'll come out and take a part in it. That's our show for this week. I hope you join us every weekend for Today in Putnam County. I'm County Mayor Randy Porter. Hope you have a great rest of your weekend, and may God continue to bless our great county.
You've been listening to Today in Putnam County, hosted by Putnam County Mayor Randy Porter.